Through this video we are aiming to give you an insight into each station of OSCE, that is assessment, planning, implementation, and evaluation, top tips for performance and the areas where each candidate should perform with utmost care and concern. OSCE in overview, the objective structured clinical examination, is one of the practical examinations specifically designed to assess the clinical competencies of nurses in a variety of skills. Each candidate is expected to demonstrate the given set of tasks in the given time frame. Moreover, these given tasks are real clinical situations a registered nurse has to handle while caring for patients in the UK. NMC expects each candidate to apply a patient-centered holistic approach to nursing and midwifery care while demonstrating clinical skills. Besides, it checks the candidate's ability to deal with real-time scenarios. For instance, each candidate is expected to showcase the ability to deal with non-accidental injuries. Firstly, the candidate should show his/her ability to assess for a safe environment for both parties. Secondly, you should demonstrate the ability to raise concerns and communicate information, and to alert other members within the team. Finally, the ability to perform tasks. In this examination, each candidate is exempted from being familiar with local policies and protocols. However, you will be assessed for nursing and midwifery clinical skills each UK nurse and midwives are encountered. Station 1. Assessment. Top tips for effective assessment. 1. Read a GP referral letter where applicable, to get a full history of the patient. 2. Ensure that you know to complete, calculate, and chart the following, and to follow the appropriate recommendations where applicable, which includes A. National Early Warning Score. News 2. B. Neurological observations including Glasgow Coma Scale. GCS. C. Patient Health Questionnaire. PHQ-9. D. Malnutrition Universal Score Tool. Must. E. Vital signs. 3. Listen to the person in your care carefully, and respond appropriately showing care and compassion. 4. Ensure not to turn off the Dynamap till you record observations. 5. Ensure to take a full minute to measure heart rate and respiratory rate, and do them manually, example, radial pulse for heart rate. For effective assessment, candidates' performance should include the following. 1. Accurately record observations. 2. Check the person's identity properly. Name, date of birth and hospital number. 3. Obtain consent from the person to carry out the procedure. 4. Check radial pulse and respiration rate safely and correctly for a full 2 minutes. 1 full minute for each. 5. Record accurately that the person was receiving oxygen therapy. 6. Record both the systolic and diastolic measurement in the News 2 chart. 7. Accurately assess and/or score neurological observations or vital signs. Example, News 2. 8. Identify the correct clinical response and monitoring frequency for the score provided. 9. Accurately record PHQ-9 and identify potential diagnosis and recommendations. 10. Accurately calculate the Malnutrition Universal Score Tool, or MUST score. 11. Accurately complete the Malnutrition Universal Score Tool. Chart to include date, time, and signature. Station 2. Planning. Top tips for effective planning. 1. Recall all the problems the patient in your care is presented with, and the most important problems from the patient's perspective. For example, pain, anxiety, immobility, or shortness of breath. Besides, is this person post-operative? If so, what problems would you expect them to present post-operatively? 2. Remember, it is vital to complete all sections in the planning documentation. Moreover, think all the person can do for themselves in relation to the problems you identified, and record this in the self-care section. 3. Review the problem in an appropriate time frame. For example, if someone is in pain, you would not leave it 24 hours before you review them. 4. Remember to refer to relevant information only from your assessment. An effective planning, candidates' performance should include the following. 1. Document self-care opportunities. 2. Provide sufficient detailed nursing interventions, which would relate to evidence-based practice for the problems identified. 3. Identify appropriate relevant problems. 4. Identify appropriate review dates. 5. Print their name, sign and date the document. 6. Avoid referring to irrelevant issues, for example noting the person was using nebulizer or had received oxygen therapy, and try not to omit to identify key issues around care. Station 3. Implementation. Top tips for implementation. 1. Read medication administration records. Mar chart aloud and say what you're thinking about for each section. For example, is this medication due today? Does the person have an allergy? What is the route of administration? 2. Develop a strategy to ensure you identify drugs that the patient is allergic to, what the allergy is, and check if the patient is prescribed on any medication containing that allergen. If so, code that medication prior to administering medications. 3. Check when the patient last had analgesia. What does that mean for this patient at this time? If it is too soon for them to have their analgesics, what would you do in practice? 4. Explain what each drug is administered for. 5. If digoxin is prescribed, the pulse rate before administration. 6. Do not sign the medication administration record till the examiner says that the patient has swallowed his or her medication. 7. Complete the documentation appropriately and get feedback from your peers and trainers. 8. You will have medications to administer in this station, and ensure that you can complete the task within the time frame. 9. Keep in mind that for examination purposes the reason for prescription is not stated on the MAR chart. But this is not considered as a prescription error. For effective implementation, candidates' performance should include the following. 1. Ensure medication is administered for the right time. 2. Ensure the patient is not allergic to administered medication. 3. Document accurately the administration or non-administration of medication. 4. Demonstrate appropriate knowledge of medication administered. 5. Ensure you use a systematic approach when checking and verbalizing all drug recordings on the medication administration record. 6. Follow all the appropriate checks required prior to administration of medication. 7. Check the person's pulse rate prior to administration of digoxin. 8. Ensure to verbalize checking of validity of prescription, including the prescriber's signature, dose, route, and time. 9. Do not record or sign the medication administration record before the person took the medications. 10. Ensure to administer the correct dose of medication. 11. Ensure that you do not run out of time, and complete the medication administration record. 12. Check the person's identification, name, date of birth, and hospital number. 13. Ensure that you administer medication during your time in this station. Station 4. Evaluation. Top tips for evaluation. 1. Ensure to read the statements a few times before answering. 2. Ensure to complete all sections in the transfer of care or referral letter to provide an accurate history of the person's care and care needs. 3. Remember all allergies. Allergies people have, what are the associated reactions? 4. Read carefully the information provided regarding the progress of the person's condition. 5. Provide a full and accurate picture of the person you have been caring for. For effective evaluation, candidates' performance should include the following. 1. Ensure to record allergies explicitly. 2. Ensure to document name, signature, date and time of transfer in the time allocated. 3. Ensure to deal with errors correctly and clearly. 4. Record the date or reason for admission. 5. Provided all accurate patient diagnosis. 6. Document the correct reason for the referral to the specialist team. 7. Ensure to outline both the spiritual and family care needs where appropriate. 8. Ensure to identify risks associated with the deterioration of the person's condition here appropriate. 9. Ensure you refer to relevant information gained during the assessment, planning and implementation stations, and referred to relevant care interventions. If you find our pinpointed presentation useful, please like our video. More precise OSCE subjects will be uploaded in the coming days. To get the notification, consider subscribing our channel. Visit our YouTube channel for more clear-cut medical subjects.